right, well, welcome everyone. This is the regular meeting of the Local Alcohol and Drug Planning Committee. My name is Eric Geyer. I chair this meeting, and I also am the Director of Jackson County Community Justice. Well, one of the things we can do is we can move through our agenda on some of the non-business items that don't require a vote. Some of our featured speakers today, we could allow to have the floor, and then we could look at doing some of the business section as a quorum arrives. I do know we have some excused absences. Commissioner Dyer could not make it today, so he let us know that he is not able to make it, as is Sarah Smith, our vice chair, is unable to make it today, so due to conflicts. Well, let's do this. The first thing we were going to do is a roll call of members and a roundtable introductions of guests and staff. However, since we are short of a quorum, and I do see that Doyle Smith is here, I'm wondering if we would be okay moving on with our agenda. And Doyle, if you would be willing to present on Dual Diagnosis Anonymous and what you guys are doing in Jackson County.
Thank you. My name is Doyle Smith. I'm the Executive Director of Dual Diagnosis Anonymous of Oregon. And it's a pleasure and an honor to be here, and I appreciate the invite. And I know some of you, and it's really nice to see you. I'm going to introduce Carolyn and John and Jeff and to show who they are, and then I'll go into the explanation of what we're doing. So Carolyn.
I'm Carolyn Morgan. I'm the Administrative Services Coordinator at DDA. So any questions you have through the central office would come to me.
And the central office is where?
We're located in Portland, Oregon, the central office.
Yeah. Right on. And then Jeff and John.
Hi, I'm John, and I'm an outreach specialist over here in Jackson County. I'm new to the DDA family, but I'm learning a lot, and I look forward to meeting a lot of you guys.
Nice.
I'm Jeff. I'm an outreach specialist for DDA. I've been working for them for approximately 13 years.
Mm-hmm. And a testimony that we can and do recover. Isn't that right, Jeff?
Yes.
Yeah, absolutely. So thank you guys for the introduction. And again, I know I have 15 minutes, right, Eric? I can talk a lot, so I better keep it 15 minutes.
It's a suggestion, Doyle. It's a suggestion. So.
Oh, it's a suggestion. Well, I see the agenda. I'm pretty anal, so sometimes I have to go according to the schedule. All right, so for those that don't know what DDA is, it's short for the acronym for Dual Diagnosis Anonymous. It's basically co-occurring disorders with people with severe persistent mental health and or addictions and substance abuse issues. DDA has been providing a 12-step peer support approach for people with that type of issue, and I'm one of them. I'm a man in long-term recovery with over 28 years of continuous recovery from mental health and addictions. My drugs of choice was alcohol and methamphetamine, and my mental health diagnosis is PTSD, attention deficit and anxiety disorder. This stuff is very personal to me. It killed my mom, killed my sister, tried to kill me, and it's killed a lot of my friends, and I'm sure that I'm preaching to the choir here around that. I got into the business of counseling and then program development and management, and then worked in the corrections for about 15 years. Doing program services and transitioning, and then became the assistant director and then the executive director underneath the founder, Corbett Monica, who passed away in 2015. And Corbett Monica, the founder of DDA, was a Vietnam vet, a highly decorated Vietnam vet. I don't know if anybody knew him, but he was definitely a force to be reckoned with. And this all got started because people that were needing peer support in 12-step type models were actually being ostracized and stigmatized even in the recovery arena, and being asked not to come to certain meetings that they were talking about this kind of stuff, or medications weren't part of the recovery process, and a lot of things like that. So there was a need, obviously, for this type of thing to take off, and Corbett recognized that when he was helping people in Fontana, California in 1996. And then from 1996, migrating to Oregon, 1998, working in the field of mental health and addictions like we all do, moved around a lot, but wherever he went, he took DDA. And from 1998 to 2005, it was getting organized. And by 2007, we got our first grant from Addictions Mental Services at the state level, which is now Oregon Health Authority, which pretty much seeded DDA. And long story short is we went from like 20 DDA meetings to national and international. Now we're seeing 3,000 to 4,000 people a month statewide, 1,400 people virtually. We're in London, we're in Scotland, we're in Ireland, we're in Canada, we're all over the place now. And the reason why I say that is because there's a broad spectrum of support. We have a Dual Diagnosis Anonymous chat room and support page that's public and members only, which has resources and/or support. The virtual meetings, was basically COVID driven, even though we did do some things online. And it's pretty amazing to watch how people find us and then respond. And then you can kind of put in perspective the secret sauce of why people are needing DDA in terms of how it's helping. DDA is a very useful, I would say, complement to a lot of the services that you guys are providing. Julia Jackson, when she was in Columbia County, which we have contracts there too, watched the benefits of DDA through Columbia, Tillamook, and Columbia, and Clatsop County, big presence. And so we approached her again after years of kind of being absent out there in your guys' neck of the wood. And it's just kind of a match made in heaven coming back there. We're trying to, I guess what I'm trying to do today, because of the limited time, is really just, give our information in the chat room, hopefully set up some networking moments for us to reach out and see how we can, connect with people's services. We're going to start our in-person meetings in OnTrack. They just gave us the go ahead for in-person meetings. We've been doing in-person meetings at the Compass House. We have online meetings specifically for your guys' region 3 times a week, but we actually got about 18 or 19 meetings going per week with, like I said, over 1,400 people a month attending these groups. So there's a lot of benefit there. And it's really an effort of joint collaboration, because we're not only, our 12-step plus 5 program that has been peer reviewed and academically reviewed for focus groups and outcomes have kind of proven how effective it can be and how it helps. And that's why we're contracted. But it's usually only that way if there's support from all around how we could be used. People that come to our meetings actually also learn about resources and how to navigate the system. And that's really important in terms of figuring things out. And DDA, which is a little bit different than other 12-step meetings, there's questions and answers, there's a process to it. The recovery process doesn't shun the medications. It's not pro-medications. It's not anti-medications. It sees the need. And we have events that are pretty important and community educating. We do conferences, workshops, stuff like that. We have a workbook that is being used by the Oregon State Hospital for didactics in terms of building skills. It has exercises in it. It's got a syllabus. We train the trainers with it. But there's a lot of substance here with DDA that's just really hard to explain in just a few seconds. So I just wanted to put myself out there for anybody to contact, know that there's 2 on-site mentors, support specialists that are in your region that are willing to help and come to places of need, on top of being regional coordinators for the stuff that we're trying to get going out there. We got a small grant from All Care too. I know All Care's doing a little bit of a presentation here for reaching further out rural counties, and we're trying to help network that as well. So that's pretty much it, as quick as I can be. I'm not sure if there's any questions or thoughts.
A couple of questions, Doyle. First of all, thank you very much. That's incredible. And am I right in hearing that DDA is Oregon born? Not that we take total ownership, but it sounds like it started here, right?
it got organized. Our central office is here, and it's spread out nationally. Now, like I said, internationally, we have a London, UK. We have over 258,000 visits to our website. 58,000 of them just were in the last year.
Oh, that is really neat.
I think I met you, Eric,
At the Recovery Fair
yeah,
in
yeah.
Eugene, where
Yeah.
Justin Hahn and I were there. I met you,
Yes.
and I was inspired by all sorts of things, and I ate quite a few voodoo donuts. I'm going to be honest about that. So I can't wait till we get together for those again in person. That was a great weekend.
Right
I agree.
Right on.
So- No, thank you, Doyle. So our chat is disabled, but what I was wondering if we could do, if you can email me any information, I can
Absolutely.
share it with the group here. But as far as a regional coordinator or rep, is that who should we contact if an entity here wants to kind of find out more about that?
Well, we like to document things, so everything should be going through the central office through Carolyn. But if there's any phone calls or any quick things that need to be done, John and Jeff are the ones right there. We'll give you their information as well, especially with flyers and brochures. We just did a newsletter that I think we sent out to a lot of you guys that kind of highlighted Jackson Care Connect this last month, and the things that we've been doing, hiring John and everything. So it's if you funnel us through Carolyn, I'm sure you'll build that relationship. Whoever will build that relationship with those two guys. And my hope is that I'm just a conduit after that. It's supposed to be all done through the counties there that are paying for it. So I would prefer that. But at the beginning, I think it'd be helpful just to establish, kind of an understanding of how things are working right now.
No, that would be great. And so we will start with that. Eddie, thanks for opening up some space there at On Track and giving it a presence. I think that as this continues to grow, there's a number of folks, particularly on this meeting, that are going to want to support however possible, whether that be space, information, whatever that is. So glad to see it starting to get a foothold, though. So
thank you, Eric. We really appreciate your support.
Yeah, absolutely. Any other questions for Doyle or the team today? Nathan Olson.
Hey, Doyle, it's nice to see you again.
Nathan.
I was wondering if you and John and Jeff would be able to come to like group supervision or come to outpatient groups or residential groups and present on DDA.
I would absolutely love to. Absolutely love to.
Excellent. I still have your contact information, so I'll reach out to you. It's good to see you again. Thanks.
Thank you. Good seeing you.
Any other questions? High fives, testimony, just anybody want to support? Yeah.
Eric, this is Julia. Yeah, thanks, Doyle, for coming and presenting on this. We're really excited about this resource, and Doyle and his team are awesome. And if anyone has other questions about the partnership or any ways that we can continue to facilitate warm handoffs, definitely reach out to Darren or I.
Right. Thank you, Julia.
Excellent. Well, Doyle and team, thank you all so much for coming in and sharing with us today. This is exciting. And it's one of those things where selfishly every month we meet and we hear about all these incredible new pieces in our community, which it makes this one of the best hours I get to spend in terms of hearing about this. So thank you again.
Right on.
Yeah. All right. Well, I have been informed that we do have a quorum currently, and we have two items of business that are of the utmost importance. One is approval of the meeting minutes for both March 24th and April 28th. Starting with the minutes from March 24th, is there any discussion? All right, the meeting minutes from April 28th, is there any discussion or comment amongst members? Hearing no discussion or comments on either of the meeting minutes, I will entertain a motion to approve both.
Move to approve.
We have a motion from Michael O'Malley. Do we have a second from membership?
I'll second.
We have a second from Amanda. Thank you. All right, Jennifer, would you please do a roll call vote from membership on the approval of the 2 months worth of meeting minutes?
Yes. Jack Adkins,
Approve.
Ron Dunn, Eric Geyer,
Approve.
Justin Hahn,
Approve.
Amanda Eisenhower,
Approve.
Rosemary Jernigan, I saw her and we need her vote or we won't.
I thought I heard, oh, go ahead, Rosemary, one more time.
I'm sorry, I approve. Do you hear me now?
Okay.
Thank you.
Yes, great. Thank you. Lisa McCready? Michael O'Malley?
Approve.
Heather Philp had an excused absence. Nick Wrighton?
Approved.
And Sarah Smith also with an excused absence. Thank you.
All right, so it looks like we passed the approval of the minutes. It is that time every 2 years where we look at the election of officers. The two officers are chair and vice chair for this meeting. So I would start by opening it up for any discussion around nominations. And in fact, open it up to nominations for chair.
I nominate Eric Geyer if he would take it.
I'll second.
I have a nomination and a second. I appreciate that. I would accept that nomination. Thank you.
Is there time for discussion?
There's time for discussion if anybody wants. Yeah, absolutely.
Well, I just want to say, you've done a great job, and you're in the right position. I've looked over the years at who would be best in the role, and you really do a great job. And I can't tell you how much I appreciate, as you said, the excitement and all the new things that have come along. For years, it was trying to get people to get involved, and you've done it. So as long as you're still interested, I'd really like you to keep doing it.
Well, thanks, Mike. This meeting has a lot of incredible people in it. So it's honestly, it's an honor to be able to serve like this. So any other nominations for chair?
Can we clarify who made the nomination and seconded it?
Yeah, I think Nick Wrighton nominated, Michael O'Malley seconded.
Great, thank you.
Hearing no further nominations, being very careful to listen though. I'm going to close nominations for chair. And we have one person. So Jennifer, we will take a vote on that after we maybe get the nominations for vice chair. So I would like, Sarah Smith couldn't make it today. She's been incredibly involved with this group though, and has loved serving in that capacity and is open to doing so should the group so choose. But certainly we are open for nominations for vice chair at this point.
I nominate Sarah.
Jack Atkins nominating Sarah Smith. We have a second?
Second.
Second.
So who was that second? I missed the first second. I think it was Justin. Justin Hahn. Sorry, Nick. So we have a nomination and a second. Do we have any discussion about Sarah's nomination? Hearing none. Are there any other nominations for vice chair for this group? Hearing none, we have two I'm going to close nominations for vice chair. We have two unopposed positions, Geyer and Smith. So Jennifer, I believe we could just take a roll call vote to just reaffirm that that is in fact the case and amongst the members here today.
Yes. Jack Adkins.
Reaffirm.
And Ron Dunn. Just making sure. Eric Geyer.
Firm.
Justin Hahn.
Reaffirm.
Amanda Eisenhower.
Affirm.
Rosemary Jernigan.
Go through. Reaffirm. Thank you.
Thank you.
Having difficulties today.
No problem, I got it. Lisa McCready. Michael O'Malley.
Reaffirm.
And Heather Philp with the excused absence. Nick Wrighton.
Affirm.
And Sarah Smith also with the excused absence. So thank you.
All right. Well, thank you, everyone. I really do love serving in this capacity, and we'll do another 2 years. So moving through our agenda, we were going to have Jackson County updates, and they have been somewhat slow due to our county's amazing COVID response in terms of the amount of resources that public health has been putting toward that. So Tanya Phillips, we're going to look at having a report out hopefully in June potentially around some of the concerns around overdose and prevention and what we're doing on that front. And so to that effect, we will move on to local treatment provider updates. I believe I started with Kim last time, so I'll start with Recovery Cafe Reclaiming Lives if we've got representation today, and we'll move our way up the list. So
I have Christy with me today. Y'all remember Christy Lashover? So we don't have a lot to report. We're, doing all of the same things, 14 circles a week and holding about 150 members, getting lots of referrals from y'all. Appreciate that. We did record a podcast today that we believe is going to be really powerful. Someone coming out of prison who has a big story. It's pretty impressive, actually, and really heartfelt. So we're excited about that. We just had an episode 7, I believe, that came out yesterday on abstinence versus active recovery. It's called The Survivors of Addiction. Yes, on most platforms. So we're still working on that. It's been great. We are just
Stephanie,
yeah.
I don't know if the chat is fully functional right now, but if you could you put the link to the podcast or the name of the podcast so folks can search it in that chat?
Sure, I'd love to.
Awesome.
I'll do that.
You don't have to do it right this second. I mean, you can finish.
Okay. All right. Other than that, I think we're just plugging along. Yep.
Great. All right. Well, thank you, Recovery Cafe, Reclaiming Lives. John Ben, Phoenix Counseling. John.
Hey, good afternoon, everybody. No big changes or updates. One small thing that we've been able to start implementing is we started last week going to UAs being done in person by appointment. So I think that is a positive thing moving forward, and hopefully we'll be able to do more even soon.
Appreciate the update. Thanks, John. Eddie at On Track. Eddie.
Hey, all. Everything's going well at On Track. No updates. Staffing shortages. Boy, I hope there's some light at the end of that tunnel. And I wanted to say congrats to everybody who got grants on the call in the first round of Measure 110 funding. We did not get one, but I'm not at all bitter about it.
That is not how you roll, Eddie. I know you. I haven't seen it. So
no, seriously, congrats, everybody. It's great news. That's it.
Awesome. Thank you. Kristen Johnson with baby stories about, Oasis is more than prenatal care, but that's what I like, so yeah.
I do talk about it a lot. I'm not sure if I turned my camera on. Oh, there I am. Okay. So, hi everyone, good afternoon. So things are going well here. I don't have a whole lot of updates. We do have a lot more babies in here and pregnant women. So that's going really well, and the program's continuing to evolve in partnership with Nurture Oregon. And also in that theme, we're really growing our Child and Family Services program. We have more parenting education opportunities and more family-centered activities, which has been really nice with some of the COVID restrictions lifting. And thank you, Eddie. We were really pleased to be one of the recipients of Measure 110, so we're really grateful for that. And we are using that to expand some of our staffing. So also filling you on the staffing shortage and some of those difficulties, but hoping that goes well for us. So thanks, everybody. That's all I've got.
And Kristen, not to put you on the spot or be too forward, but I believe you guys are going to present to the group overall about the Oasis service model and what holistic services can look like for families working with behavioral health concerns. Is that fair?
Today?
Not today. No, down the road, right? This is a coming attractions. Not, I wouldn't be.
Surprise.
We'll just keep on going. I did put a request in about the prenatal program and talking about that. Is that what you're referring to?
Absolutely. I think it would be great to hear. Yeah.
Okay. Well, we will definitely take the opportunity to talk more about Oasis. So just let us know when that is. And
okay.
Yeah. All right. Thanks, everyone.
Awesome. Thank you. All right. Kyle Gray, Medford Treatment Center.
This is Joanna from Medford Treatment Center.
Hey, Joanna.
How's it going?
Good.
So not too many updates. We are seeing an influx of admissions right now. There for a while, we kind of saw a lull, and so now we're getting an influx again. So getting more people into treatment. Other than that, no other new updates.
Well, that's a good update that folks are getting connected. So glad to hear that, Joanna. Thank you. Julia, Max's mission. And should I start saying, is it August? I don't want to say the wrong date, so I'm going to let you say it. Go ahead, though.
August 28th.
Right. That's what I was going to say. Okay, good. August 28th.
Yeah, Saturday, August 28th, we are in Hawthorne Park for Overdose Awareness Day. And we are looking forward to having speakers. Eric, anybody else who would like to come and speak? More than welcome. Please contact us. And lights, more lights this year through Jackson and Josephine County. We are hoping for a bigger display. And then we also are busier than ever. We're out many times a week, giving out naloxone, harm reduction supplies, Jackson, Josephine County. We were very happy to be in receipt of Measure 110, or will be in receipt of awarded funds. So that is allowing us to do quite a bit more. So, so that's great. And we're probably getting to hear about, I don't know, at least about 8 overdose reversals a week, 8 to 10 between the two counties. Some of those are from a while ago and some of those are very recent. So seeing lots, hearing about lots of overdoses out there.
Thank you, Julia. And we will keep saying August 28th, August 28th. That's good marketing, right? Just repeat it.
That's it. That's it. Thank you.
All right. All right. Sarah's excused today, so she won't be updating us. But is Cynthia here from Copia? Well, I see Dane ready to go. So Dane, let's go ahead and skip ahead and hear about HIV Alliance. Thanks.
You know, we had a good month. In April, we did 15 new in Jackson County, 37 refills, 12 reversals. That was 32% of the refills were done because of a reversal. So I think that's pretty dramatic. Josephine, we did about 15 new, 39 refills, had 5 reversals. I think the 10 month is kind of dramatic. We saved about 87 lives in Jackson County since July 1st last year, 69 in Josephine, for a total of 156 lives that were reversed because they had naloxone. And I think it's just really concerning with the amount of fentanyls out there. It's in everything. I mean, we just prepare them that they're going to OD with whatever they buy on the streets. You know, and I think that's, you got to have that kind of attitude, is that be prepared, carry naloxone, carry lots of naloxone to be prepared for a fentanyl overdose. But that's what's going on. The peers are doing a great job. They're doing a lot of park settings, and they're working with Jackson County Health Department, getting as much out as we possibly can.
No, that's tremendous, Dane. Thank you for that update. And that is both hopeful and sobering at the same time, that information. So I appreciate the update. Justin from Boulder Cure? No, Justin. How about Jody from Allied? I saw her on the call earlier.
Ooh, sorry.
Oh, Justin, did I skip it? Oh, sorry, man. Go. All right.
No, I was just, having a, oh no, that's my name. Much like a lot of us, we also are starting a hiring process again for new peer coaches and a peer coach supervisor and a peer coach care team coordinator, which all those jobs are, you can find them online at Boulder Care. And we are ramping up, taking now any Medicaid for Oregon, which is really, really cool. And looking to, not that that makes a huge difference, but just so that you know, looking to do the same in Washington as well with Medicaid, which is really, really great because access, as we know, is super important. And you should start to see some flyers out there hearing about Jody, our nurse team lead is out there, and she was at Max's Mission yesterday, I think. And you'll see her out and about. And yeah, just really excited always to just be part of this and see you all and see what we're all doing. It's really cool. Thank you.
It is, and I always appreciate your updates, and hopefully it didn't catch you too much by surprise there.
No, I was ready, and then my headphones were like.
Good cover, man. Good recovery. Jody from Allied.
Hello. There's really no big updates right now going on with Allied. We're just still plugging along, getting admissions, and I think we've added a few more groups to our schedule, so we're doing good there.
Great. Appreciate it, Jody. Thank you. And Kim at the ARC.
Handing this over to Nathan.
Thanks, Kim. So we thank you, Eddie, for recognizing the people that were awarded those grants. We were a recipient of one of the grants, and that's going to allow us to provide training to 10 individuals in our community to be trained as certified recovery mentors. After they complete that training, we will be opening up 5 positions for CRMs. We're looking for bilingual, bicultural individuals who can go out and be part of our community engagement team. And we also have Dr. Doug Deal onboarded as our new Chief Medical Officer. He started about a month ago, 3 weeks ago, and is really hitting the road hard. He's working with the hospitals and primary care clinics to really help establish relationships between ARC and those entities. So lots of stuff happening. We also are, working on workforce development and hiring. We have a couple open CADC positions and a couple open CRM positions and some other positions as well. I think we have about 13 open positions currently.
And I think that's one of the refrains we're hearing is just the difficulty in hiring within our SUD treatment system, and how I don't think that's totally unique to Jackson County, but it's acutely felt here because the need is so great. So appreciate everybody plugging away at that and working to build a solution there. We have all care on our list. However, Jeffrey Piacatelli told me he was going to be out of town, and I'm going to assume for my own well-being that he's on an awesome vacation. I'm not sure why he was out of town. But we do have Darren Dale, and I believe Julia might still be here from Jackson Care Connect with any updates.
Hi, everybody. It's Darren. Julie had to step off, so you have me giving the updates. A lot of exciting things going on. I think the 2 things that come to mind for us, just for this group, is really happy to see the new resources Mike O'Malley mentioned earlier about. It's great to see the last couple of years of new resources coming in this space, and I think the DDA and Doyle's group being here is really, really good. And I've already been contacted in the middle of this meeting by a couple of providers wanting to get connected with them. So that's great. But, and then Justin from Boulder Care, just as he mentioned, we just finalized our contract with Boulder Care and Jackson Care Connects, where they're able to take our members. So we're really, really stoked on that as well. Just bringing those resources in for our members. The other big thing is just, the theme that has been constant throughout this meeting and others that I'm in and all of you are in, is just the workforce crisis that we're all in. And we've identified this as a major initiative at the Care Oregon behavioral health level. And we're just eager to support our providers in a variety of different ways. And I've already been in touch with several providers in unique ways in trying to provide support in this space. And we're talking about things like retention and sign-on bonuses, recruitment efforts, training, et cetera. So we really kind of put this to the forefront of our priorities. And I think it's one place that the CCOs can support. So we are really appreciative of all the work that Network's doing and just doing all we can to help plug those holes. And it's a pretty big challenge. So, but hopefully we're getting a handle on things, but that's about it.
Thanks, Darren. Appreciate the update. Not sure if we have anybody from OHA here today. Dr. McElveen, Greg Bledsoe, Sam Byers. Hearing none. I don't believe Andrew Swanson could make it today either. He is in the midst of legislative work. Sarah Smith is out. Dr. Trotta? Wow. Well, with that said, that actually does in fact exhaust our entire agenda today. Appreciate everybody's work and attendance. And I certainly want to thank all of our guests from DDA and just kind of sharing some of the excitement around what that means for our community. So With that said, we will get together in another month and share our stories and maybe even hear about Oasis. So we'll look what all that looks like, and take care. Appreciate it, guys.